Hello, my friends. I have another interview. This is round 2 with Nicole Cozean, an amazing physical therapist who, you guys, if you're not following Nicole, Nicole, you're at Pelvic Sanity on Instagram. Is that correct?
Yeah, and then I also have at Nicole Cozean DPT. So we have both, and they can link back together. So mine's more of like for practitioners, and then we have Pelvic Sanity for more patient stuff.
Awesome. Well, Nicole's Instagram is just fun, and she's just fun to follow, and I admire her work so much. I actually personally know some people who've gotten great results by working with her. So, yes. So anyway, I want to actually dive in today on our topic, which is kind of a rapid fire fun Q&A with the top 8 myths of IC, interstitial cystitis. And I'm going to let Nicole really briefly say kind of what that is, also known as painful bladder syndrome, or at least that's what it used to be known as. But we're going to bust some myths related to that. And so, Nicole, if you can just start us off by maybe defining what is IC, and then we'll bust those myths.
Okay, so interstitial cystitis it's still widely known as a quote bladder pain syndrome. But it's basically a pelvic pain condition where there's 2 major symptoms: urinary urgency and frequency, usually pretty severe, feeling like you kind of like have a UTI all the time. And then also the second component there is some sort of pelvic pain. So those are the 2 like hallmark kind of symptoms of it, and those are the 2 symptoms that are used to diagnose the condition.
Yeah, and I do have a question for you that's off the cuff of our top 8 myths, and that is, how did you get so interested? Because I know that this is kind of a big focus of your work. Is it simply because you saw so many clients with this, or was there another reason?
Yeah, when I actually started in pelvic PT about 14 years ago, I was actually working at a hospital clinic in Orange County, California, and there was a really prominent urogynecologist that was seeing quite a bit of interstitial cystitis. So when I started the pelvic floor program there, him and I got hooked up pretty quickly, and then I just happened to start seeing a lot of interstitial cystitis patients really early on in my career. And so that's how I sort of got started in it and started seeing success, despite what I was reading on the internet. And when I was doing research on the condition to help my patients better, I kept seeing very like contradictory things to what I was seeing in the clinic. And that's what sort of started my there's like a lot of misinformation about this condition, and it persists still. Even this long later, but that's what we're trying to sort of combat, is that misinformation about the condition.
Well, and that's what I love about you, is that you really are a mouthpiece for kind of putting information out there to this world. In fact, our first interview that we did when my hair was long, so gosh, It was a couple of years ago, but it's actually titled, "Is Your Back Pain Caused by Pelvic Floor Dysfunction?" And so if you want to look that up, look it up. It's a great interview. I also introduced Nicole a little bit more in that. But I mean, even in that realm as well, you're really awesome at, like, I don't know, just exposing kind of things that maybe aren't so often in the research. It's like exposing the real clinical way that things are presenting, and exposing some myths, and exposing all sorts of things people need to be aware of. So I thank you for that. And with that, let's go ahead and bust the first IC myth, which is IC is solely 100% a bladder condition.
Yeah, this is the biggest myth. I think this is one of the most important myths, because when we only focus on the bladder, then we can miss a lot of treatments that can be helpful for interstitial cystitis. So some of the latest research coming out of both the RICE study, which is a study that was done on interstitial cystitis, and the MAP research, which for all of us nerdy people, we don't really care about what that is, but basically there's a ton of research that's coming out that is showing that the interstitial cystitis, what we think of as a bladder condition, is actually much more of a larger pelvic pain process, of which has urinary symptoms and pelvic pain symptoms, but it's not necessarily all about the lining of the bladder, which we used to think. So I think when you focus so much on bladder-centered treatments for a condition that has other components, we can miss a lot of things that can help people with treating the condition well.
And is that simply because everything is so closely connected in that area and inflammation is going to kind of impact the surrounding structures? Or do we not even know?
Yeah, well, we do know a little bit. That's definitely one contributing factor. But then the other thing is that with the more stuff that we understand now about chronic pain conditions, it is also about the nervous system and how your brain and bladder are sort of talking to each other, and that gets disrupted with interstitial cystitis. So there can be a ton of almost 90% of people that have been diagnosed with IC actually don't have anything physically wrong with the lining of their bladder.
Mm-hmm.
And that's where the name kind of gets a little bit funky, right? Because bladder pain syndrome, means that it's something with your bladder. But there's a really awesome doctor who's done a ton of this research, and his name is Dr. Ken Peters, and he always talks about it being that the bladder, we're now learning that the bladder is so much more of an innocent bystander in this larger sort of pelvic pain, pelvic floor dysfunction process, that we need to start broadening our treatments towards what we actually think is some of the underlying causes.
Oh my gosh, that's amazing. I love this. Okay, well, let's go ahead and move on to number 2, which is IC is a rare condition. This is a myth.
Yes,
IC is a rare condition.
So this comes from the fact that we used to think that, and this is a little bit tied into myth number 3, but we used to think that IC was super rare. No one really had it. It was started to think that it was just these lesions in the bladder called Hunner's lesions. But it wasn't until the 70s, the 1970s. So IC was sort of like first recognized in 1914 by Dr. Hunner, and then he is the one who found these lesions in the bladder. And then for a lot of years, almost 60 something years, we thought that it was definitely a bladder condition. And then it wasn't until 1970s where some researchers found that, 90% of people actually don't have these lesions in the bladder, only 10% do. So what the heck? And then once that was sort of thought of, then it's like, then the prevalence of this condition now, the diagnostic criteria isn't just Hunner's lesions, right? It's this huge, much more broad condition. And then some other research even later than that found that basically up to 12 million people in the United States alone have symptoms of interstitial cystitis.
Whoa, so that is crazy.
So we go from something that we think is super rare to something that's relatively common. And the impact of this myth is that doctors in the clinic are taught to, when you hear hoofbeats, think horses, not zebras, right? So if they're operating under the assumption that interstitial cystitis is actually rare, then when you come in with these symptoms of UTI-like symptoms, but then you have a negative culture and all these other diagnostic things, then they're thinking, their thought process is going a completely different way, other than thinking that, it actually might be interstitial cystitis because it's not as rare as we kind of think it is. Mm-hmm. So that's sort of the impact of the myth, is that it can impact your diagnosis and may actually delay you getting the help you need if the doctor's on the wrong diagnostic path.
Yeah. Wow. Okay. And so you said that this does tie into myth number 3, which is that IC is a condition that only affects women. So
yes, here we go. So this is also based in so when I was doing the research for the book, we found that everybody kept saying, citing this one research study, that interstitial cystitis was most common in women over the age of 40. And I was like, we know that's not true. But so I looked back at that research study and be like, what the heck is this all about? And it was actually based in one study that was based in one county over like a 20-year period, of which there was only about 20 people in it, 18 people, some of which were 20 years old and some of which were 80 years old. And so the median was 40. So, and most of those people were women. Mm-hmm. And so that is a myth that has now been busted by one of those big research studies that we showed, that when you actually look at the symptoms, the prevalence of IC is actually almost the same in women as in men. Men still are shy of us by a couple percentage points, but yeah, it's much more common in both genders than we originally thought. So,
Wow.
and
That
again,
is good. No, go ahead. Go ahead.
Okay, so that is another way that men can actually get, a delayed diagnosis, because again, if you're not thinking that that can even happen in men, then they go to the urologist with these symptoms and they're not even thinking interstitial cystitis, right? They're going to think all kinds of other things, when in fact, it's actually not that uncommon to have interstitial cystitis like symptoms in men. And sometimes that's also called chronic prostatitis in men as well.
What? So,
Yeah.
so you're saying that chronic prostatitis is essentially interstitial cystitis in men?
So the research that has come out recently has basically postulated that it's probably under the same umbrella.
Mm-hmm.
If it's not the same condition, it's super similar. So we don't quite know definitively, but so we kind of use these terms interchangeably, because there's another statistic where 92% of men that have been diagnosed with chronic prostatitis can also be diagnosed with interstitial cystitis based on the diagnostic criteria. So there's a lot of overlap between those conditions, right? So only 8% of people that have been diagnosed with chronic prostatitis don't actually meet the criteria for IC. So really, at the end of the day, the overlap is pretty significant. And for physical therapists, the treatment is similar and almost identical. So it doesn't really, at that point, it doesn't really matter what you call it, tomato. It's the same kind of intervention.
Yeah. Interesting though, thinking about how much medicine is changing all the time as we are learning new things. It's fascinating. So
totally.
Okay. So how about this one, number 4, there is a standard IC diet. This was back when I was in clinical practice and was seeing patients with IC. People were always talking about the IC diet. So
yes. So this myth is one that I think is like kind of the most pervasive in the community, because like if you Google interstitial cystitis, it's like that's what comes up, the IC diet. Try the IC diet. And it's a super restrictive food list, and can be really overwhelming for someone that's just learning that they have the condition, because they interpret that as all of the things that they should not and cannot eat. Yeah. But in reality, there is no such thing as an IC diet, meaning there is no one diet that people have to follow that will help their symptoms definitely. So everybody is so individual. There's tons of interstitial cystitis, people with interstitial cystitis that can eat whatever they want, other people that are super food sensitive. So I put this as a myth because there's not one list that you should follow as a person that has these symptoms that's going to definitely clear all of your symptoms or even help everybody the same way. So the standard that we now have been more pushing is to just do an individual elimination diet and find your personal food triggers, because the average person with interstitial cystitis only actually has about 5 to 7 food triggers. But if you're thinking it's a bladder condition and you do see a correlation with food, because that is a thing, then you're eliminating a lot of foods for no reason for you personally, when they might not actually be contributing to as much of your symptoms as you think they are.
I love that. It goes back, that bio-individuality is so huge. And I think that the stress of having that super restrictive list has got to make your condition potentially even worse if you're like, oh my gosh, no, I can't eat anything. So
and we need, as you are so good at talking about, we need to like nourish our bodies. Yes. And so I actually, in the book, we talk about one patient that was actually so malnourished because she was restricting her diet so much. She actually had to get medical intervention for that. So she was like only eating like chicken and white rice, and that was it. And that's just not going to help you heal anyways, you know? So, so now the gold standard we know is just to find what trigger foods are yours, and then you can stay away from those and then eat healthy in whatever way that means for you. And then that can really be a helpful tool to take the fear out of eating and fear out of food.
For sure. And you referred to your book. I would love it. Do you have a copy right near you by chance?
I happen to.
Yes. Yay! Oh my God.
Yeah, so it's called the Interstitial Cystitis Solution. It is written for patients or people with the condition, but it is also very much can be a practitioner guide as well. Everything that we talk about is here is evidence-based as much as we can have it be. And and there's all kinds of cool lists and charts and things to fill out for you as patients to be able to take to your doctor and be able to talk to them with education and some research backing to what you're saying so they can take you more seriously, honestly.
Oh, I love that. That's so amazing to see your book baby go out. I'm sure that's exciting. And I don't think there's much out there right now that's for the patient that's so well researched. I would say I haven't seen anything. So awesome.
And the last one that was written was done by a really prominent, really great doctor, Dr. Robert Moldwin, but he wrote it over 20 years ago. And so when we were looking at all of those researchers, I was like, oh gosh, we need to update this stuff.
For sure. Okay, so we have a couple more myths. So the next one kind of goes along with the IC diet, and it's that acidic foods should always be avoided. And I have to say, I totally fell into this trap again back when I was clinically practicing. This was now 8-9 years ago. I would definitely say, you want to avoid tomatoes and acid foods and soda and stuff like that. So please, I repent and bust that myth.
And the reality is that it is true that a lot of the foods that typically trigger people with interstitial cystitis do have the property of being acidic outside the body, right? But the reality is, my point with this myth is that what acid in doesn't equal acid out. And there's a very complex biochemistry system going on when we ingest food. Some things turn basic that are actually acidic. Our blood and our bodies neutralize acid so that our blood pH stays the same, and urine pH actually fluctuates significantly throughout the day for everybody in trying to keep our blood pH very stable. So I don't like when we take big chunks of foods, right, and then eliminate those from our diets for a reason that might be for an unfounded reason, essentially. So yes, some people might happen to be triggered by certain acidic foods, but that might not be the reason. There's actually some evidence to show that histamine and histamine releasing foods and foods that are high in histamine actually have a higher propensity to trigger people with interstitial cystitis and other inflammatory conditions. So it's we just need to make sure that you're finding your individual trigger foods for the right reasons and don't take big chunks of things and eliminate those when you haven't actually proven that they are affecting your symptoms.
That it's the acid and not necessarily maybe it was the histamine that was in the acidic foods. Yeah.
Right. Or some other type of reason why you personally are sensitive to that food, that compound, that whatever. So that's where, again, it's just all about eating healthy, taking the fear out of food. Don't eliminate big chunks of foods just because someone said acidic foods are bad with interstitial cystitis. And that's just not how biochemistry works in our system. So I just wanted to bust that myth as well.
So good, girl. Okay. So how about this next one? Elmiron is the only medication option.
Yes. So there are only 2 FDA approved drugs for interstitial cystitis. One is something called DMSO, and it's actually instilled into the bladder, meaning you can fill your bladder up with that medication and then pee it out, and it can help. It's a little bit old school. And then the other one is an oral medication called Elmiron. And this is very much prescribed a ton because a lot of doctors, especially that aren't familiar with interstitial cystitis, look up and see what is the medication I can prescribe. Elmiron, go.
Yeah.
So there's a lot of pitfalls with Elmiron, and a couple of which are that some of the best studies that are done on it have only shown for it to help about 30% of people. So really, at the end of the day, it doesn't have a huge high efficacy rate. There's a ton of negative side effects, and of recently, pretty significant evidence that long-term use of it might cause retinal damage. There's actually a study going out in Kaiser right now. So again, if you're on it, then don't get crazy and don't
Yeah.
like stop taking it necessarily without talking to your physician. But it is one of the more frequently prescribed drugs. And I wanted to put this as a myth because we need to understand that it takes 6 to 8 months to work. It only works for about 30% of people. And it has some pretty negative side effects, both for GI disturbance, hair loss, and now we're finding this eye situation. So I want people to make sure, and the assumption is that it's working on the lining of the bladder, which we now know isn't the whole story.
Yeah.
So what I want people to realize is just to have informed consent, essentially, and knowing what you're taking and why, and don't let Elmeron, the prescription of Elmeron, be the only thing that you're doing intervention-wise, because there's a lot of times where doctors will prescribe it and say, well, come back to me in 6 to 8 months and we'll see if that works. Well, there's a ton of stuff that you can be doing in the meantime to help your symptoms that have a lot higher evidence and efficacy than 30%. So,
well, and physical therapy treatment, do you have evidence? I feel like I've read something from you that there is evidence to support that it is a higher efficacy than 30% success rate with Elmeron. Yeah.
100%. So the AUA guidelines, the American Urological Association, actually did a whole deep dive of the research and showed, like, gave grades, like letter grades, A, B, C, D, and F, right? To what does the evidence say about that intervention? And physical therapy actually gets the highest evidence grade. We get a grade A, meaning that we can help, I think the rates are up to like 75% in the literature of patients with interstitial cystitis with going to pelvic physical therapy. So,
that is amazing. Yes, really that makes me so happy. A conservative treatment, no medication required. So talk to your doctor though, work with your doctor on this. So the next one is a myth that says IC pain is all in your head.
Yeah, and I always say I wish this didn't have to be a myth anymore. I wish that there was a more understanding in the medical community that people aren't making up this type of pain, that yes, it can be that severe. And yes, it can feel like you have a UTI even though you test negative on a culture. So, with this myth, I also want to talk about, so we know that the pain of interstitial cystitis can be very real. And how it affects your nervous system, stress, pain, can upregulate that nervous system and integrate with the fight or flight response, right? So then you're in this state of, I'm going to fight, I'm going to freeze, or I'm going to flee, right? Yeah. So I want to also point out that during this time, even though the pain is not in your head, it is a very real and physical symptom, we do still want to make sure that we address the mental health component of dealing with a chronic pain condition like interstitial cystitis. So yes, it's not in your head, but it certainly needs to be a part of your holistic healing to address either the way that you deal with stress or anxiety. If there's anxiety, a history of trauma, there is a lot of mental health components that integrate with the physical part, with the whole mind-body connection. So it's definitely, the pain is real and it's physical, and there's things that we can do to help that part. Then there's also the component that while the pain isn't all in your head, your mental state and status can directly affect how you're healing through IC. So
yes, and I would love to insert that I really love Lorimer Moseley's work. That book, Explain Pain, is so good. It's easy to really understand that pain physiology from the book called Explain Pain. I'm sure it's still available, but he's a wonderful lecturer. He's funny. Again, that's Lorimer Moseley, and it's not about interstitial cystitis, but it's just about, in general, chronic pain conditions. So really good stuff.
And we typically they also have a really cool little workbook for patients that's not the entire Explain Pain book. It's like pretty thick and a little bit pricey, but they have an Explain Pain workbook that is really good. It's only about $30, and I give that to a bunch of people. Almost all my patients have something like that, or we talk about that a lot. It's a really cool little workbook.
That's awesome. I didn't know that. I'll have to look that up.
Yeah.
So, okay, so we have one more myth, and that is that it's an incurable disease. You've got it forever. It's never going to get better.
Yes.
Bust that myth, girlfriend.
Oh, big time. So this kind of comes like full circle, right? Because there's so much. That's the first thing you'll read besides the IC diet is that, oh, this is a chronic incurable condition. And the myth that we want to bust here is that there has to be a cure in order for your symptoms to go away, and that those two things are not necessarily mutually exclusive, right? So we don't have cures for a ton of things. We don't have cures for the common cold, the flu, diabetes, like all these things, but they can be very well managed to the point of being symptom free. And so that's what I hate the term cure for IC. I don't like the term disease, even though technically, I guess by definition it is. I like to call it more of like a chronic pain condition, and those things can be managed, especially when we know, and we go back full circle to IC myth number 1, that it's not only about your bladder. So there are so many things that we can tackle and address and really find sort of like the root cause and the underlying reason why you're having those symptoms. And it's not necessarily only about the bladder, and that should give people a ton of hope that there are so many things that we can do to decrease the symptoms. So the first sentence of my book is that thousands of people with interstitial cystitis live healthy, happy, and pain-free lives, and so can you. And that really is true. And it's not necessarily that it's an easy road to get there, but it certainly is true. And just because there's not one pill or one procedure that you can do to make everything go away doesn't mean that you can't get the symptoms significantly down or even eliminate them.
Oh, beautiful. I love that message of hope. And it really reminds me of so many of these pelvic pain or pelvic conditions that we deal with. I mean, even, prolapse, pelvic organ prolapse,
Yes.
or all sorts of pelvic health conditions. There's not necessarily going to be a cure that's going to magically make the organs go back into, the place that they were at when you were 16 years old. But we can manage the symptoms. We can make it so that you're not seeing, depending on the level of prolapse, we can make it so that you're not seeing some of these concerns. We can make it so that it's not getting worse. We can make it so that you live a perfectly normal, perfectly functioning, perfectly joyous life, even if you are not cured. So yeah. Oh, you are speaking my language, and this was amazing. I think we tackled all of the myths.
Yeah.
Was there anything else that you'd like to leave people with about interstitial cystitis?
No, I just that with the message of hope, really.
Yeah.
That I love that leaving on that last myth.
Yep.
And to get to a pelvic physical therapist that understands chronic pain conditions, because in the camp of pelvic PTs, there's some people that focus a lot on postpartum concerns like prolapse, incontinence, and all of that. And then some of them don't have as much either desire or knowledge to treat the pelvic pain condition. So if you have interstitial cystitis, just make sure that your pelvic physical therapist has that training, and then go from there.
And do you have a resource that you tend to recommend folks who are looking for a PT locator? I usually refer people to the section on women's health, APTA physical therapy locator, but maybe you have one that's more specific and honed in.
Yeah, I wrote a blog post actually on it because I do think that it's important to cross-reference all those lists. Because, for instance, the APTA one is only lists people that are APTA members. So there's limitations to every single list out there. So I think that I have a blog post that lists all of the a bunch of them, and then you should basically look at all of them, cross-reference them, and see if there's someone in your area for sure.
Okay, I'm going to be sure to get that blog post. I'm making a note right now
to
get that blog post, and we'll put it in the video notes. So amazing. Thank you so much, Nicole. And I really appreciate you. Where can people find you? We already mentioned your Instagram. Maybe say it again. Mm-hmm.
Yeah, so Instagram is at Pelvic Sanity, which is the clinic that I have in Orange County, California. We do remote consultations. We have out-of-town program, and we see people with IC all the time. I'm at Nicole Cozean DPT, and then you can check out our website at pelvicsanity.com for all of the information and things about our clinic on there.
And one more time, show us your book.
Oh yes. This is the Interstitial Cystitis Solution. The holistic plan for healing painful symptoms, resolving bladder and pelvic floor dysfunction, and taking back your life.
Ooh, girl.
And it's on Amazon.
Awesome. Thank you so much. I will probably see you again because maybe third time's a charm for another interview. You have so much goodness to share. So,
totally. Well, thank you so much for having me. I really appreciate you.
Of course. All right. Bye.
Bye.